It's Time Warner Cable's Local Edition. I'm Brad Pomerance. Our guest is State Senator Ted Lieu. Thank you so much for joining us, sir.
Thank you.
I want to speak with you about the Affordable Care Act. We are in rollout of the healthcare exchanges here in California. They're known as Covered California. And actually, the response has been higher than expected. We have significant numbers signing up. We have significant numbers at least going to the website. Surprising to you, sir?
No, because
Really?
there is a huge demand that's been pent up for decades to get health insurance. In California alone, there's 6 to 7 million people who don't have health insurance, not because they don't want it, but because they can't afford it. This now makes it affordable.
Now, I think it's fair to say that with regard to Covered California, there have been some technical glitches, not as bad as in other states. Some states literally had to delay their launch. What would you say about those technical glitches? Are you concerned that that's going to sour the general atmosphere behind it, or were they not so significant that we can move on?
So with any large rollout of a program, you'll have some technical glitches, but Covered California has done pretty well. In the first week alone, they signed up over 30,000 people. That's very impressive.
What's interesting, I was reading that Kentucky, of all places, actually had very high sign up. I mean, per capita, much better than any other state.
Well, if you don't have health insurance, it really doesn't matter where you live. You're going to want to get it, especially because it can be very affordable. Even if you're young and you don't think that you can afford it, you'd be surprised. Go on Covered California.
And I do want to talk about the young, because it is undeniable that if Covered California or any of the exchanges don't get enough healthy young people to sign up, there will be too many infirm and elderly people signing up, and that could cause what's called a death spiral, that it will just be economically unsustainable. Where are we today as we speak about the young and healthy signing up?
So it's too early to tell, but because of that issue, they've put in two things. One is they do have less expensive insurance for younger folks. And second of all, as you know, there is a penalty if you don't sign up, you intentionally choose not to have health insurance.
So I understand that what we know is catastrophic policies for young, just in case something happens, are available. But in terms of the penalty, some have said that the penalty is simply too low.
So we'll see. We won't know, but hopefully people will sign up, because when you ask most folks, it's not that they don't want health insurance, it's because it's not affordable. Go on Covered California. I think for many people, they'll be surprised at how affordable it is.
I want to ask about your district. You represent almost 1 million people, bigger than some states.
It's ridiculous.
It is quite remarkable. Only 40 Senate seats in the state of California. Are you getting calls? You're on recess right now, so you're out and about. Are people asking you, or they think, oh, you're a state, I don't need, I'll talk to my congressman, or even though the state's operating it?
We're getting very few calls,
Really?
Largely because in California, the rollout has been fairly well received. And again, in the first week alone, over 30,000 people signed up.
What about the Medicaid expansion, which California has accepted?
Yes.
Because that also is a key part of decreasing the number of uninsured.
Yes, I support the Medicaid expansion.
Right, but do we know how that's going? We don't.
Yeah, still too early to tell.
Right. As a general proposition, though, we look at both Covered California and the Medicaid expansion, and we know that so many folks who don't have insurance, it's just a fact, may not be English dominant.
Correct.
What is happening on that front?
I'm very pleased the governor signed my bill, Senate Bill 353, that requires health insurance plans to translate their core documents into different languages.
Does that include Covered California, for example?
Covered California also has their own rules that does as well. Mine applies to private health insurance
So you
plans.
feel as if the message is getting out in any language necessary?
Absolutely.
Okay, his name is Ted Lieu. He's a member of the California State Senate representing significant portions of, I guess, the South Bay. I'm Brad Pomerance. It's Time Warner Cable's Local Edition.